I'm going to talk about COVID and the impact that it had on families, on you. I should point out, as Susan already said, that I'm a psychologist by background. I am not here to comment on what restrictions or what changes should have been put in place, but I can reflect on the impact of those changes for those who are pregnant, who are giving birth, who are a new parent, and everyone who was involved in caring for them, because your experience hugely changed as well. So I want to do two things with this presentation. I want to recap some of the main changes that took place and the impacts that they have, but then also thinking about, well, what do we need to do now? It's all very well recognising the emotional difficulties, the pain that people went through, but what can we learn from this and how can we take that forward? So we know that during the pandemic, and particularly during the lockdowns, there were some major changes to maternity and postnatal services care. A paper here actually looked at all the different changes that were made to different services in England during the first lockdown. And as you know, there were major changes to how care was delivered. So the majority of appointments were happening in some cases over phone call, over video, but also changes to the birthing experience as well. So some limitations in some areas on home births, water births, how women were monitored through their pregnancies, and the postnatal care they received afterwards. We also know that they were one of the biggest changes that parents talked to me about were the changes that were made in terms of partner support. So this paper was really interesting to me, and it sent out a Freedom of Information request to every maternity services in England in relation to partner restrictions during that first lockdown. So as you're probably aware, there were major changes in whether partners were allowed to be present or not. So we had 90% of areas saying that partners weren't allowed at the 12-week scan, 88% not allowed at the 20-week scan. If a woman went in with bleeding or restricted movements or in any other emergency situation, her partner usually wasn't allowed to be present. Most partners were allowed to be present at some point during the birth, but this was usually towards the later stages, so women were going into hospital alone and the worry that was there for them. One of the most interesting, shall we say, statistics for me was that almost half of trusts were saying that they restricted when a partner was allowed to be present at a home birth. So even though they were in their home alone, the partner had to go out the room until a certain point because protocols were being followed. We also know that this didn't impact on families equally. So when partners weren't allowed to be present, perhaps for a new mum who was having a straightforward pregnancy and going along to the scan, yes, she would have really wanted a partner there for all sorts of reasons. But that's a very different situation to not being allowed to have your partner there if you'd just been told that you'd miscarried and lost the baby. So it's thinking about the inequity in the impacts that happened. We also know that in relation to all these changes, the changes in maternity and postnatal care were slower to change back again when society started to open up a bit more. So if you think back to 2020, in the summer of 2020, we had the situation where you could start going to a football match or out to dinner with your friends or to a nightclub even at some point, but you still weren't allowed your partner present. So these changes lasted for a long period of time. We also know that they happened in postnatal care. So even though the World Health Organization, Royal College of Paediatrics and Child Health are really quick to say, please do not separate mother and baby unless it is really, really necessary, a lot of separation went on. We know that in some areas, particularly in some of the English trusts, there were quite a lot of restrictions around neonatal care. So some hospitals were considering a mother to be a visitor to her baby. So they were following visitor guidelines for the hospital, and the mother wasn't able to go and have free access, that sounds terrible, it's the wrong word, free access to her baby in neonatal care. So rather than thinking of mum and baby as that dyad that can stay together, there was that separation. So we know all of this has happened. We know we can't go back and change it, and it would be remiss to say that absolutely everybody had a really difficult time through this. When we talked to women postnatally in our research, we found that for some women, they started talking about some of the positives of this. It was during the first lockdown, and it should be pointed out that the weather was nice. It was probably the initial, novelty is probably the wrong word, but that first lockdown, in most people's memories, is very, very different to that one that occurred all the way through the winter. But nevertheless, some families were saying that for them, there were some positives postnatally because they had this slower pace of life. They had partners at home. They had time to get to know their baby without pressure to have lots of visitors and be out and about, and it kept difficult visitors away. So just kind of keeping that kind of in the back of your mind. However, we know that there's a big negative side to it. This is a quote from some research that we did into women's experiences of breastfeeding, and just one of the mums really summed it up. So, my mother is wonderful and a huge supporter of breastfeeding. I was really looking forward to her coming to visit after my baby was here. She cannot come, and whilst we can video message, it's just not the same as having your mum close by. I feel I need her, not just to help, but emotionally, and I'm struggling without the support. It makes everything feel so much harder. And if you are caring for parents during this time, you all know a mum or a dad who felt like this. We all know that for some, that social isolation, that lack of emotional support really affected their postnatal experience. And it went on for a long time for some mothers. Of course, this all has an impact, and it has an impact in two ways. Starting to look at a number of the studies that have been coming out around parents' mental health during the pandemic, most of them are showing a rate that has tripled in those studies for antenatal depression and anxiety, postnatal depression and birth trauma. Many studies that I've looked at have shown postnatal depression rates of 50%. And on the one hand, I often think that's a huge number, and then I think, well, how come the other 50% weren't depressed in this situation? It had a phenomenal impact upon some parents, even though some were more protected from it. We also know that it affected you, it affected midwives, it affected health visitors. And there have been some really interesting studies that have started coming out about the mental health implications for those who worked in pregnancy, birth and postnatal care through this. And this was one of the studies that was particularly interesting to me, talking about the levels of stress and anxiety and depression that were increasing amongst those who were doing the supporting. And there were lots of different impacts of that. And for some, they found that these feelings didn't emerge until later on, almost until you were safe, and that you were no longer dealing with that immediate impact of having to care through parents through these changes. It was things like perhaps fears for yourself if you had a health issue, fear for others of taking the virus home, particularly when we didn't know so much about it, being forced to play that role of gatekeeper. So a number of midwives in particular have said to me that they really struggled with being the person who was at the door essentially and said, no, sorry, you can't have your partner in yet, you're not far enough along. The impact of having to care in a different way, so having to interact with parents differently, not being able to offer the different choices that you knew they wanted and you knew they would benefit from, particularly when you were dealing with first-time parents, because you were often in the situation where you knew about services that were no longer available for them, or you knew about care that was no longer available for them, but they may not have. And it was that moral injury, essentially, of having to work in a way that you might not necessarily have been happy with. We know as well, not being able to have that connection, not being able to do so much sitting close to people and hugging and home visits, and just the huge impact of having to have that PPE on, having to disinfect, having to do all of that. It plays its toll. And a huge part of this is recognizing all of this and just realizing the emotional trauma, the load, the experience that parents are carrying with them, but those who are doing the caring are as well. So a key question is, well, where do we actually go from here? What can we do? And there have been lots of talk about what we need. Right during the first kind of time after that first lockdown, the Babies in Lockdown report very much talked about, right, we need a boost. We need this baby boost. We need investment in services around pregnancy, birth and postnatal care so that we can come back from this. And on a big societal, governmental kind of level, this is really important. We do need that investment. But in terms of what that might look like, I just started to think about why is it important that we invest in those who have been through it, even though it was in the past. And it's about going back and not necessarily catching up on or giving them the opportunities that they've lost, but kind of making up for it. So making sure that there are opportunities for them to meet other parents that they may not have met before, for children to experience those activities, those connections with other children that they haven't had before. And I say children because those babies who were born in the first lockdown are now 2-year-olds running about. So a lot of parents say to me, you know, I'm still feeling some of the effects, and my baby's talking, he's running about. Also, just more opportunity to develop that relationship with health professionals. So yes, you might not go back and meet your midwife from 2 years ago, but meeting your health visitor, meeting other professionals around you. And just services as well, that those ones that were so disruptive and that parents never got the chance to go along to. But on a more practical day-to-day level for things you can do, it's about actually reflecting with parents and talking to them about what they have been through. What I found during the first lockdown is when I started talking to parents on social media about the impact of everything that has happened, quite a lot of parents said to me, actually, we feel we can't talk about this because my baby's healthy, because I'm healthy, because we weren't the ones, you know, in those clips in the hospitals. I feel that I can't talk about how difficult it was, but actually it's a really important part of helping them process it and move forward. And just talking about the logic of how they were feeling. Yes, they may not have been critically ill, but they missed out on all those stages, that expectations of what their pregnancy, birth, and that maternity leave would look like. The meeting the family for the first time, showing off your tiny baby, but instead having to show off a 7-month-old, which of course the relationship is still there, it's still important. But actually just talking them through that, them not being able to go to baby groups, even just the little thing about not being able to go and meet new parents in the same way, it's all a loss for them. They're grieving that, and sometimes recognising that is just enough to move things forward. And of course, it's about supporting more severe problems, so supporting and signposting anybody who needs mental health services who may not think they do because they think they haven't been through anything particular. And just supporting that bonding and connection with their baby, because one of the big things that parents have said is that sometimes when they were separated or because they had a really difficult postnatal period, that they don't feel that bond and connection to their baby. So it's talking about lots of skin to skin, not just being for newborns, a bath with your baby, wearing your baby in a sling, anything there. Of course, it's about you as well. And we know that we've come through COVID, and we're still in a crisis in midwifery services and health visiting services because there are not enough staff, there is not enough investment. And it's about recognising that. And the same messages again around we need the government to invest in those services, invest in funding, invest in that leadership opportunities for people so they can catch up on what you may have missed because things were so busy. Of course, we need the investment there for that. And the big thing for me is about restoring your well-being and having chance for you to think about what you have been through and what you may have missed out on and the traumatic experiences that you may have had on that day-to-day level. And this is from the Royal College of Midwives, very much recognising the need for investment in mental health of those doing the caring. But of course, we need the monetary investment to provide the staff and the support services there. So it's one of the things that we're pushing for. But it's about being alert to the symptoms in yourself and in your colleagues in terms of burnout, in terms of that trauma experience, and being kind to yourself in recognising that this was a completely abnormal time. And sometimes that's just some of the first steps in starting to heal from that and move forward. And touched on this briefly earlier, but now is one of the biggest times when mental health issues can start to present. Quite often when you're going through something, it's all about survival. It's all about getting through the next day. When things start to calm down a little bit, I don't want to say, they've completely calmed down, but in terms of that immediate threat has gone, then it's when people often start to fall apart because they start to process it, they start to feel it and experience it. So if you're recognizing that in yourself. This is some quotes from some research I was doing with those who are working specifically in breastfeeding and lactation support before the pandemic and during the pandemic around their well-being, around supporting them. They're specifically from those working to support breastfeeding, but I think they're really, really relevant to everybody in terms of thinking about ways you can start to protect yourself and the things that are important to remember around you and that you matter. From a psychological perspective, realise that we can only do so much and we aren't responsible for all of infant feeding. If we make a difference to one mum, then we're winning. And it's about seeing the individuals in front of you, realising that you cannot save everybody, realising that there's always going to be stress, there's always going to be difficult situations, but taking time to recognise who you are supporting and whose lives you are changing, because on that individual level you are. The boundaries, and I always feel like a complete fraud saying this, so if you work out how to do this, this is brilliant, but boundaries are extremely important. It's vital to me that I have a life outside breastfeeding and I live it. So again, it's thinking about how can you force yourself to make that distinction so when you leave, you're not thinking about things constantly. What can you do that helps you calm? I remember one of the key ones, and Sue loves this one, that somebody suggested that we all need a gin in a hot tub more often. And I think that is going to be the kind of my memoir, that gin in a hot tub. And again, looking around you and developing good working relationships with other supporters, with other colleagues and with other professionals. And we're stronger together, and it sounds a little bit cheesy, but it's absolutely true. The connections you make with that one important other person or that small group of people on your WhatsApp group can really be the difference in supporting yourself. And just finally, going back to that slide earlier about people who have had positive experiences, can we go back to this? Can we learn from that, from those mothers who had a good time postnatally because they essentially had that time to rest and look after themselves and connect with their baby and connect with those around them? What can we learn from some of the positive changes? And more importantly, how can we apply that more equitably? Because we know that those who had a good time generally came from more privileged backgrounds. How can we keep that for others? How can we protect that postnatal period and that really special time around birth to make it about the mum and the baby and the partner and the connection? So going forward, it's about looking at you just as much as anything else.